Thanks ever so much for the invite to chat tonight. This started with Optum, the company that was Optum. Now, most people out there, maybe some people in the room here, couldn't tell you what Optum do. They couldn't tell you who they are. They couldn't tell you whether they've got any significance to Brighton or not. But they have a lot of significance to Brighton, and this piece of work got kicked off thanks to the Optum entering our local health economy. Optum as a company, they're a subsidiary of UNISON Health. They're an American company, and they're very, very good at two things. The first one they're very good at is getting sued, and the second one they're very good at is putting in unrealistically low bids in order to win contracts that they cannot necessarily deliver on. Now, both Optum and in their previous incarnation, pre-2013, have been pursued through the courts in America for medical fraud. As a result of this, in Parliament, Jamie Reid, who I understand was a shadow health minister, said in Parliament that he questioned whether Optum had any place in the National Health Service or any place in health provision in Brighton. Despite this, a contract was given to Optum to provide for a service called Referral Management Service in Brighton. Now, this was a contract that was given a while back, and it seemed to be given without a great deal of consultation, in the sense that a lot of people didn't know anything about it. They just suddenly appeared. Optum were now doing this job, and Referral Management Service, folks, is where you go to your GP, and the GP refers you on somewhere. There's a tertiary kind of triaging body that makes the decision as to whether your GP is right or not. And they are the Referral Management Service. They used to be run by BICS, they're now run by Optum. Now, the question is, how did they get in there? How did Optum, if Optum have got a problematic history, if they're described in Parliament as having no place in the British health system, how are they in Brighton? How are they making decisions as to whether you, when you go to your GP, end up getting to see a specialist or not? Because they are, that's what they're doing right now as we speak. Well, it started off a chain of conversations in Sussex Defend the NHS, which I'm a member of. And I did a little bit of research into CCGs and their constitution, and something clear came up. CCGs have a responsibility to ensure that patients and the public are actively involved in their commissioning arrangements. Okay? So they have to involve people when they give out commissions. The problem is, how do you consult on Optum? How do you consult with people on something they know nothing about? It's a very difficult thing to do. They can consult on certain things. How did you experience your local GP? How did you experience a hospital service? But how do you consult on Optum? People don't know who they are. They don't know what they are. They don't know what they do. It's an almost impossible task. So, what we decided to do was, at the university, in conjunction with Sussex Defend the NHS, was to undertake a process of consultation on our own. And we looked at a bit more research before we did this, and we found out that actually it wasn't just us who were concerned about this. There's research for the second year in a row that suggests that healthcare professionals around the UK do not feel that CCGs reflect their own beliefs and their own values in their commissioning. So the notion that CCGs are a representative body actually doesn't really hold up. A whole range, including GPs, believe that their current CCGs and the CCG's commission services are not representative. So that's a problem. Secondly, it seems to be the case around the UK that cost effectiveness is the key criteria, not clinical significance or clinical importance. And that's another issue that we were kind of concerned about, as well as the issues of transparency. So we thought to ourselves, we would go out there and we would undertake a survey, as many people as we possibly could across the city. And the idea was we would ask them questions that they are not being asked. Because if you go to the CCG, they'll say, well, we do consult. We talk to small groups of people, we get Health Watch to ask various different questions, and Health Watch do ask various different questions, but they don't ask questions about values. People in this country, and just as people in this room, they've got significant relationships to the service providers that are beyond whether the service is good or not. It's actually important to some people that they have a publicly funded NHS free at the point of access. That's actually a really important element, but it's not something that gets asked. The CCG will not go out and ask somebody whether or not, or the people of Brighton Hove, whether they want a private provider to take over a public service. So our idea was to go out and ask those questions for them. The Health and Wellbeing Board, when they've announced this big 21 point How much is it? 21.9 million cut over the next 4 years for their adult social care budget. Have they asked people what they want about that? Have they asked how normal people, whether or not they are happy with that, or whether they think that their local council should be doing more to resist these kind of cuts that are coming on high? So the idea is we put together a survey asking the difficult questions that don't seem to be being asked under the guise of consultation at the moment. So we got this survey out, as some of you may have seen it. We got the first one out as widely as we possibly could, and we found a number of findings. They weren't particularly surprising to those of us who undertake this kind of work regularly. 93% of people said they should have been a public consultation, a full public consultation on Opt. Okay? 90% of people were genuinely concerned or very concerned that Optum are even in their health economy in the first place. This is important. Okay, the CCG are essentially commissioning on our behalf using public money. And the people of Brighton and Hove don't seem to be bought in to the fact that this company are now in our city. As was already mentioned, 88% of people preferred the NHS to private providers, and 92% of people agreed with the statement, health companies should not make financial profit from people's health problems. So there's clear questions on values that are important for the CCG. So when they're sitting down thinking what company to give various different contracts to, they have to take this on board. And the reason they have to take this on board is because they have a legal remit to represent the public. Unfortunately, they also have a legal remit to represent Health Watch, monitor the wishes of the Secretary of State for Health and various others. They've got many, many remits, and the public, I believe, is getting lost in this. Because I don't believe that the commissioning that's happening across the country and in Brighton represents public wishes, regardless of where you are on the political spectrum. This is not a left versus right issue. Many, many, many people, a vast majority of people who vote Conservative, don't want a privatised National Health Service. So, what do you do with it? You go out and collect this information, but what do you actually do with the information? It's no good just putting it in a little report, because nobody reads reports. So what we tried to do, as well as having a launch, we tried to put together a plan to approach the Health and Wellbeing Board. Now, Health and Wellbeing Board has a range of local councillors, but they also have 5 members of the CCG who've been co-opted onto their board. So therefore, if the Health and Wellbeing Board would invite us to talk, the CCG would have to listen. Because up until now, even despite the fact that we've done all this work, the CCG were not replying to our calls. They weren't interested, they didn't want to be involved in the survey. So they've given us, on June the 7th, at the next Health and Wellbeing Board, they're going to give us 15 minutes to do a presentation on our findings, and the CCG members there will have to listen to those findings. We've also, possibly as a result of this, since then, the CCG have asked to meet us to talk about this issue. We're now developing a second survey based on a lot of the other issues that people are worried about. GP practices closing down, a patient transport system that's been given out to a company that is absolutely not fit for purpose, and which means that vulnerable people are routinely denied care to hospital that they need. You know, cancer patients, kidney dialysis patients. This is absolutely critical, and it's affecting people right now. These kinds of issues are going to be on there, and we're going to use this to feed back, because I don't believe that that these issues are being consulted upon properly. And I think if you ask the right questions, you find that a lot of what's happening with the CCG is really problematic. We're hoping to set up a national network in order to get some of these things going from different universities around the country, in the hope that we can start to coordinate some of the messages a little bit more broadly. Don't get me wrong, I don't think for a second that the ideological headbangers in the government are remotely interested in this information. They are not. They do not care about consultation, and they don't really care about what people do or do not want. They are hell-bent on their strategy to completely privatise the National Health Service as soon as is possible. However, local councillors who are elected and local CCG members, they do. They actually care about this. It's important to them. They realise, the CCG members, they're not used to being told that 1,500 local people don't agree with what they're doing. it actually makes a difference to them. They're not like the people who are in government. People who are up for election in the coming years. These sorts of things are important. I can't say for sure whether they're going to make any kind of change or not. But we started this to try to bring together this yawning gap between the people of Brighton and Hove and their values and how their NHS is being commissioned or how it's being sold off locally. And we're going to keep doing this in the hope that it builds some pressure on these local councillors and CCG commissioners so that they can at least feel and they can see and they can understand that the public know what they're doing and they're not happy about it. All right, thanks very much, folks.